It's Dr. Yun at St. John's, and it's 2021, and we're almost a year into the COVID-19 pandemic, and it's been such a difficult, challenging year for so many of us. But there's so much hope on the horizon right now. Almost everybody on the team and the staff has received their second vaccine, and we've figured out how to keep patients safe. And so we're just bringing you up to date in these next few moments on how we are approaching joint replacement in this new era. So as much as we wanted everything to go back to normal, it's become quite clear that that isn't going to happen in the near future. And so we've had to implement changes and maintain changes over the course of the year. We've modified all preparation and recovery protocols. Very importantly, we had to incorporate mandatory COVID testing of patients, not only to keep the hospital safe, but to identify those asymptomatic patients with COVID. And this is a very important part of our protocol. We've identified a number of patients who are asymptomatic who tested positive, and that we were able to safely defer their surgery. And for many of these patients, once they cleared their infection, their test came back negative. 1, 2, 3 months later, we are able to safely proceed. And then above all, the whole goal of this program is to maintain the safety of patients, the providers, our families, and the hospital. It's most helpful to understand where we are by looking at the different phases of a pandemic. The first is when there's exponential growth, spreading of the virus, the number of cases, the number of hospitalizations, the ICU capacity all becomes full, and then we need to lock down. The second occurs when there's a gradual reopening of essential services, even if it's at limited capacity. The third is then we see a broader reopening of restaurants, gyms, and stores. And finally, what we all hope for, a return to normalcy, when schools and all the other social activities that we used to do are reopened to us. And despite our best wishes, it doesn't look like there will be a return to normalcy in the near future. And so until then, we need to maintain the precautions that were implemented over a year ago. Most importantly, we're continuing with social distancing and masking practices. Fortunately, on top of that, we now have the power of immunologic barriers. The entire hospital staff has been vaccinated, as well as the surgical team. Patients over 65 are now being vaccinated at the hospital. We're also pursuing active surveillance, which means temperature and symptom monitoring. There's also routine periodic COVID testing for the surgical team, as well as mandatory COVID testing for each surgical patient. Now, specifically in early 2021, these are the metrics that we're following. These may be subject to change. Right now, all patients will need a negative COVID-19 PCR test prior to the scheduled surgery. The test must be done at the hospital. It has to be a PCR test. The rapid antigen tests are not sufficient. Antibody tests are not sufficient. And even if patients have had a vaccination, a COVID-19 test will still be necessary prior to surgery. At this time, caregivers are still discouraged from being in the hospital. We're trying to reduce the number of interactions. There was an attempt to bring caregivers and visitors in late last fall. That didn't work out so well. And so for the time being, no visitors or caregivers are allowed. We know that's difficult for patients, but we are trying to protect the hospital. We are also trying to do as much virtually and preoperatively, arranging for medications and home health and other issues all before surgery. We are still being selective on who can and cannot have surgery. All patients are surgery candidates unless there is a reason to believe that the patient will require an ICU stay or an extended stay at a nursing home or a rehabilitation facility. So again, all patients are currently candidates for surgery unless they will require intensive care monitoring or extended care at a rehabilitation facility. But our expectation also is in this new environment, there is limited hospitalization. There are many patients who choose to go home the same day, and other patients choose to go home after one night staying at the hospital. And we will still maintain social distancing precautions with masks at all times and no visitors. There are two main pathways that a patient may follow after surgery. Since COVID, there are many patients who will choose to go home the same day after surgery. So specifically, they will go home between 4 to 6 hours after their surgery is completed. They will be discharged immediately from the post-operative care unit. In the post-operative care unit, or the PACU, patients' vitals and hemodynamics will be assessed. Pain will be controlled. Once it's clear that the patient is moving well with physical therapy, they're walking with good balance, they're able to go up and down stairs, their neurovascular checks and post-operative x-rays are normal, we will give them the option of going home the same day. We also maintain the option of the more traditional path. Those are patients who would prefer to stay overnight for observation, or patients who have pre-existing conditions that need to be monitored overnight. And in those situations, the patients will move from the post-operative care unit, or the PACU, to the orthopedic care unit. The orthopedic care unit is a separate sterile unit. It's completely away from any of the COVID patients. There have been no transmissions of COVID on this floor since surgery started over a year ago. On that floor, they'll receive orthopedic nursing, physical therapy, occupational therapy, and pharmacy evaluation. And then once it's clear that they're medically stable and they can meet the below criteria, they too will have the option of going home. The key to successful surgery and recovery in this environment is all of the preoperative preparation. And so post-operative care typically is all arranged before surgery. So patients will receive necessary equipment for recovery and therapy. The nurse will call in prescriptions for the caregiver to pick up prior to surgery. Home health and the follow-up visits will all be arranged, and there'll be a post-op appointment 3 weeks after surgery, which can also be done virtually. And so we are very aware that these are extremely challenging times. There's been so much tragedy and loss. Fortunately, though, we are able to provide essential services like joint replacement, even despite the tragedy of COVID in the community. We've done it in such a way that we can protect the resources of the hospital, but also in a way that keeps our patients, staff, and our families out of harm's way. Since this began, we've done over 950 surgeries without any transmissions of COVID to patients, to staff, or to families at home. And we've done this through a program of discipline, surveillance, masking, and now with vaccinations. And we hope to continue this protocol of safety in the coming year.